All right, guys, the purpose of this video is to go through some blood work. This is one of the first things I do for everyone in my clinic. This is really a way that I can see what's going on in your body from a physiology perspective. So what I wanted to do was take this time to show you what your blood work is going to look like, explain it to you, so that when we meet in person and go over this blood work, we can really dive into some specific things. Instead of talking about what each thing means and why it's important, I wanted to do that here so that when we actually meet, if something's off or if we need to dive into something a little bit more in depth, then we could take that time to do it without having to go through this blood work line by line. So let's go ahead and get started. Again, if any of this doesn't make sense, you can always come and talk to me. You can always ask me questions, but I just wanted to use this video as a resource for you. All right, so let's go ahead and get started. So the first thing we're looking at here is something called total IgA. Total IgA is an antibody. Antibodies fight antigens. Antigens being the bad things like viruses, bacteria, anything that shouldn't be in the body. If you have elevated antibodies, that's telling me that you have increased antigens, specifically in your gut. So this is looking at gut specifically. So if you're dealing with a lot of gut issues and you have an elevated IgA, that's a sign that you may have an immune reaction going on in your gut, and we have to fix that. The next thing we're looking at is something called celiac disease. Celiac disease is where you can't digest and absorb gluten. So in this particular patient, and I X'd out names and dates and everything like that. This is a female patient, just so you know. But in this patient, she does not have any markers of celiac disease. So that means that she doesn't necessarily have any trouble digesting wheat or gluten. But if you look down at the next marker, this is celiac genetic markers. So she does have a positive celiac marker for genes. Now, just because one is positive does not make her have celiac disease, but there is a chance that this negative can become positive and she could develop celiac disease. Or this also could mean that she does have a gluten sensitivity. So if we see a positive here, then we are going to be a little bit more apt to make you gluten-free or gluten-limited. Next page. Now we're looking at an anemia panel. Anemia is when you don't have enough iron in your blood. And we're looking at two things here, something called ferritin and iron. Ferritin is the storage form of iron that lives in your bone marrow and muscles, and then iron is actually what gets pushed out of your bone marrow and out of your muscles into the blood. Iron carries oxygen. That's why iron is so important. So in looking at this, with this patient here, she has a normal level of ferritin, and you can see the reference ranges on the side. She has a normal middle-of-the-road ferritin and a normal iron. So she is not iron deficient or does not have an iron deficiency anemia. So that looks good. Nutrients, some really key ones here. Folate, vitamin D, and B12, huge key nutrients. If they're off, you're going to be off. These three nutrients do about 400 different things in your body. And again, if they're off, 400 different things are going to be off in one way or another. So it's really important that these be as good as possible. Now, when you look at folate, you'll see it's above 20. That's way different than that reference range. You see, they want it to be above 4.6. I actually like it above 20. So there's something we need to talk about. There's normal ranges and optimal ranges. I want you to be in optimal. Just because it's in the normal range doesn't make it good necessarily. So we're going to be talking about when you come in to go over your blood work, making sure you're in optimal ranges. And so optimal range of folate is above 20. Next is vitamin D. Again, she's in normal range at 49, but optimal range is in the 80s. So I'd like to see vitamin D in the 80s. And also, we'll kind of be talking about if you do have a vitamin D deficiency, how do we fix it? So after we go through the blood work, I'm going to kind of then talk about, okay, what do we do to fix this? And with vitamin D, really supplementation and diet is how you're going to get vitamin D into your body most effectively. And then B12. Now you notice she has a high B12. I'm not too worried about that. Obviously, I'd like her to be a little bit lower. It doesn't necessarily need to be high, but vitamin B12 is a water-soluble vitamin, meaning that anything you don't use, you kind of pee out. So it's pretty tough to overdose on B12, but she doesn't need as much B12 as she's taking, so I'm going to go ahead and lower her dose just a little bit. Again, supplements and diet are how you get most of your vitamins in you. If you're not getting enough in food, then we got to do a supplement. Next page, we have our rheumatoid arthritis panel. Rheumatoid arthritis is a autoimmune disease, meaning your body's attacking itself, and it specifically attacks your joints. This patient does not have rheumatoid arthritis. And then if you scroll down here on this page, you see something called ANA. ANA stands for anti-nuclear antibody. Anti being against, nuclear or nucleus. Every cell has a nucleus or a brain, so that's the nucleus of the cell. And then an antibody, remember, antibodies fight antigens, antigens being the bad guys. So this is an anti against the nucleus antibody. And what that means in plain English is your body is attacking its own cells. So this is called an autoimmune disease. So this is a marker of autoimmune disease. So if it's positive, you would have an autoimmune disease. But then also, it depends on how positive it is. And if you have a positive, we'll discuss how to fix it. This patient is negative, so this patient does not have any active or aggressive autoimmune disease going on at this time. This is another autoimmune disease specifically for lupus. This is called dsDNA. Again, if positive, we'll let you know what's going on and how to fix it. But most of the time you'll be negative and we can move on from that. Again, another autoimmune disease that she does not have. This page is all heart, all stuff heart related. So we have lipids or cholesterol. So we have the LDLs, that's the bad cholesterol. Something called apolipoproteins, which are the ships that carry cholesterol from place to place. So cholesterol is waxy, fatty, oily substance. Blood is water. Oil and water don't mix. So something called apolipoproteins have to surround the cholesterol and ship them from place to place. So these apolipoproteins are very important and actually have been shown to be more of an accurate representation of heart attack risk than cholesterol by itself. So you'll notice I don't have any total cholesterol or HDL or anything like that. I do have triglycerides at the top, but it's because science has shown us that those numbers don't really mean anything anymore, that really the more accurate representation is the apolipoprotein, so we'll go over that. And then inflammation. So friends, cholesterol isn't the problem. Cholesterol actually is very important and it saves your life time and time again. If you don't have enough cholesterol, you're in big trouble. What makes cholesterol bad is when it's inflamed. That's what we need to make sure of. So we need to make sure your inflammation factors are down so that the cholesterol isn't that big a deal. So first thing we're looking at is triglycerides. Triglycerides are free-floating fatty acids, so after you have a meal, your triglycerides will go up. The problem is when they're up all the time. So this person was fasting, and you'll notice she still does have an elevated triglyceride. So again, more free-floating fatty acids to potentially clump up and clot. So we don't want that. We want that to go down. LDL direct. LDL is famously known as the bad cholesterol. So again, we want to make sure that that number's low or low normal. And then apolipoproteins, again, the ships that carry the cholesterol from place to place. ApoA1 is the good cholesterol ship. ApoB is the bad cholesterol ship. And then you put them into ratios, ApoB to ApoA1. So good cholesterol, bad cholesterol, and ratios. Again, you always want a good ratio. You want to have more good cholesterol than bad cholesterol floating around. Again, because the reason it's bad cholesterol, the reason it's called bad cholesterol is that the cholesterol that accumulates in the arteries. The reason they call it good cholesterol is that that's the cholesterol that picks up the bad cholesterol and takes it back to the liver, takes it out of the arteries. Now, remember I told you cholesterol isn't really your enemy. Cholesterol is your friend. Cholesterol becomes your enemy though when it becomes inflamed. So looking at inflammation, PLA is looking at specifically blood vessel inflammation, so that's where the cholesterol live. So we want to make sure those aren't inflamed, because if your blood vessel's inflamed, then more cholesterol is going to hang out there. Homocysteine. Homocysteine is an amino acid, a breakdown product of protein. If you have too much amino acid, or excuse me, too much homocysteine floating around, that's been shown to be linked to heart attack, stroke, dementia, and Alzheimer's disease. Again, you'll see this patient is in normal range. It's in green, but remember, normal may not be so good. I want her to be in optimal range. So optimal of homocysteine is 6. That's where I'd like her to be, at 6. So we're going to help her lower that. And actually how you lower homocysteine is with B vitamins, specific B vitamins, not just B vitamins you can buy at any store. So we'll talk about that. If you have elevated homocysteine, we'll talk about how are you going to lower those with the B vitamins that I'm going to suggest. Something called HSCRP, or high sensitivity C-reactive protein. This is a sign of total body inflammation. So if you have total body inflammation, it's not necessarily telling me where you're inflamed, but you are inflamed. And inflammation in general increases risk of a lot of bad things: heart attack, cancer, Alzheimer's disease, all these different things. So we want to make sure that your inflammation is low, never zero, right? Inflammation, inflammation is a good thing, right? You just don't want it for too long or too high. If you have no inflammation, you never heal. So we want to make sure that your inflammation is at a normal level, not high, because high inflammation causes breakdown. So that's why we're looking at inflammation. And then the last one here on the sheet is oxidized LDL. And that is a sign of cholesterol inflammation. And if you have cholesterol inflammation, that increases your risk of the cholesterol clotting and you having a heart attack. So we're really going to make sure with this patient that we get that number down right away. And again, if you have this issue, we'll really talk about how we do that. More stuff related to heart. Myocardial stress. So myocardial is the muscle of your heart. That's what the fancy name of your heart muscle is. And this is making sure you don't have any heart failure. So this patient does not have any heart failure. And then apolipoprotein markers. So when it comes to cholesterol, size does matter. With cholesterol, we want your cholesterol big and fluffy, not small and dense. So what we're looking at, this is called SD-LDL, or small dense LDL. So this is kind of the worst of the worst cholesterol. So you want to make sure that this is nice and low, and this patient is. Again, if you're high, we'll talk about why that may be and how we're going to fix it. Blood sugar. 2 very important markers when it comes to blood sugar is something called hemoglobin A1C and insulin. Hemoglobin A1C is a 3-month average of your blood sugar. You have to remember, blood sugar is up and down depending on eating or fasting or stress, whatever it is, right? So, just getting a 1 moment in time blood sugar doesn't really give me that much information. But if I can take that information and spread it out over 3 months, that gives me a lot more information and a lot more helpful. So you'll notice this patient is 5.6, which puts her right at the top of normal range. So she's almost pre-diabetic. So we want to make sure that we work on getting her sugar down. Another big thing we look at is insulin. Now, insulin is a hormone that helps sugar get to where it needs to go, helps it get inside the cell. When you're fasting and your insulin is high, that's telling me you have something called insulin resistance, and that's a sign of impending diabetes. So with this patient having an elevated hemoglobin A1C and an elevated insulin, she is at very high risk for getting diabetes. So again, if this is your picture too, we really need to make sure we talk about, okay, how are we going to fix this? What are we going to do to prevent having diabetes? Again, if you don't know what diabetes is, it's not a fun thing to have. Next is something called the Comprehensive Metabolic Panel. This is looking at liver, kidney, electrolytes, all the different things that really make up your body's main systems. So first 3 things, sodium, potassium, and chloride, are electrolytes. Again, electrolytes are always up and down. It's really normal for me to see like a high or a low in these markers. So again, if you have a high or a low in these markers, don't worry too much about it. If it was truly high or low, you'd be in pretty bad shape. So sometimes it's just moment in time. So don't worry about a high or low here unless it's really high and low, and we'll talk about it. The next thing is carbon dioxide, what we breathe out. Again, if you had a lung disorder such as COPD, if you know what that is, or some type of issue with your lungs, you may have an abnormal carbon dioxide. Also, sometimes when people are getting blood, they hold their breath right when the needle goes in, and I'll see like a low carbon dioxide level or a high carbon dioxide level based on that. So if you have a low or a high carbon dioxide and no real lung issues, it's probably because you're just holding your breath. The next one is glucose. So that's the moment in time glucose. So you'll notice that one's a little high. And that kind of makes sense with her past one, her hemoglobin A1C and insulin. Kind of makes sense that her glucose was high at that moment in time. The next couple, BUN, creatinine, eGFR, and BUN creatinine ratio are all kidney markers. So you'll notice with this patient, everything is good until you get to BUN creatinine ratio is slightly high. And that's usually what I see in most patients. So if you have an elevated BUN creatinine ratio, one of the most common issues is that you're slightly dehydrated at the time of blood draw. So we're going to talk about getting you a little bit more hydrated. But if you have abnormalities in those, we're really going to sit down and talk about kidney health and make sure that it's nothing more serious. Below that is calcium. Her calcium is very normal. And then the next, all the rest, albumin, ALT, AST, that stands for bilirubin total, protein total, and alkaline phosphatase. Those are all liver and bone measurements. So again, if you have any abnormalities in there, it may be an abnormality with liver function. Again, nothing to get too concerned about, but we will talk in depth what we need to do and how we need to fix it. Thyroid. So you have a lot of different things going on in your thyroid. Your thyroid is a gland that lives in your neck. The brain talks to the thyroid, and that brain chemical, that brain hormone that talks to the thyroid is something called TSH. And you'll notice that's the third one down here on this page. So that's the brain talking to the thyroid. And then the thyroid releases something called T4, which turns into free T4. And you notice her free T4 is normal. And then that free T4 turns into free T3, which is normal there too. So you'll notice that her TSH is normal, her free T4 is normal, and her free T3 is normal. Now, there's a difference between normal and optimal. For TSH, I'd like to see your TSH in the 1 to 2 range. And again, if you're not in that range, we'll talk about how to get there. I'd like to see the free T4 about where she is, 1.1, 1.2, 1.3. And then I'd like to see free T3 in the high 3s to low 4s. And then the rest here is anti-TPO, reverse T3, and anti-TG. So anti-TPO stands for anti-thyroid peroxidase antibody. Again, that's an autoimmune marker of your thyroid. If you have autoimmune disease of your thyroid, such as something called Hashimoto's disease, then that may be elevated. Same thing with anti-TG or anti-thyroglobulin, right? So if you have a autoimmune disease of your thyroid, those two will be elevated. If you have something called Graves' disease or hyperthyroidism, that reverse T3 may be elevated. It also may be elevated for other reasons, but that's something I look for in the blood. Again, if anything is off here, if anything is not optimal, we'll talk about how do we get you to optimal in office. Hormones. So thyroid is all hormones. These are some other hormones, kind of known as sex hormones. You may recognize them. Estrogen, you may recognize estrogen, you may recognize testosterone, you may recognize a couple other ones, but estrogen, testosterone, cortisol, another big one that people recognize. These are all different things. Now, again, we'll talk a lot more in depth when you come into office. Again, what's normal, what's abnormal. If something says low, that's a pretty good indication that it's low. If something says high, it's a pretty good indication that it's high. But if something says normal, again, it depends on your age, it depends on your sex, right? This is a woman's marker. Men, you'll be a lot different. You'll have the same hormones. Men, women, children, we all have the same hormones, but your hormone levels will be different. So this is a woman. So again, normals for women are not the same as normals for men. So what we'll go through is, what do all these hormones mean? I'll show you some charts as to how they get formed and where they come from, and I'll let you know if they are low or high. and how we're going to fix them. But it's just something for you to see. Again, if something's low or high, it's probably a good indication that it really is. And you'll see in reference ranges here, these are reference ranges for a woman. Men, you'll see the reference ranges will be different for you because you're a man and you have different levels of hormones. This is called a CBC, or a complete blood count with differential and platelets. So basically what this is all your blood cells. First thing you'll see there is WBCs, which stands for white blood cells. White blood cells fight infections. Then the next one you'll see is red blood cells. Red blood cells carry oxygen, nutrients, sugar. So that's what that means. Then all the rest of this stuff is, I call it the pieces parts of the red blood cells and the white blood cells. The color, the thickness, the consistency, how much of it's being produced, all different types of white blood cells. There's so much stuff to talk about here. And we'll talk about any highs and lows that go on here and what they mean for you. Google, if you Google this stuff, just be careful with that. Again, if you just look at blood work and not the whole picture, not at the whole person, again, you're left to make some assumptions as to what these may be. So we'll really sit down and talk over some highs and lows and make sure that you completely understand what these highs and lows mean. Are they dangerous? And what can be done about them. Next page, looking at a couple of, it's called other markers, random things. Something called total IgG. Total IgG is an antibody, again, something that helps fight off the bad guys. This is what I call your long-term immune system, long-term immune system. So you'll notice in this patient, her long-term immune system numbers are normal. Then next is IgM, another antibody. This is what I call your short-term immune system. You'll notice it's a little low. Now, again, don't get scared. It doesn't mean you necessarily have an autoimmune disease or any type of immune issue, or you have a poor immune system. But, it's something we need to look into. I'll see some low numbers on relatively healthy people, and we may need to check into it further, but it may be nothing too. So don't freak out if you see highs or lows. We'll talk about it, and we'll make sure you get on the right path to fixing it. Uric acid is a breakdown product of protein. Too much uric acid is called gout. So if you have any gout issues, that may be a sign of why you have gout issues, and we can fix that with diet and supplements. Coenzyme Q10, probably a popular thing you've probably heard of, helps with heart health, but it's also a really important antioxidant. So you'll notice she was taking a lot of coenzyme Q10, and that's fine. You can't really overdose on coenzyme Q10. So again, she doesn't need to take all this coenzyme Q10, but again, it's not going to hurt her to take it. I did lower her coenzyme Q10 just a little bit, but it's something that we definitely don't want to be low. So this is a really important antioxidant, not only for the heart, but for the rest of the body. Cystatin C is another kidney marker. So again, if I'm really worried about your kidneys, this is another way I can test you for kidneys. Magnesium, very important mineral. Does it again about 400 different things in the body. So it's really important that that be at good levels. And she's at very good levels, 2.3, at least above 2. That's what I'd like to see you at. GGT is a liver gallbladder marker. So looks like her liver gallbladder is good. LDH stands for lactate dehydrogenase. That's a sign, so hers is a little elevated. This can be a marker, it's a marker of a lot of things, but it could be a marker of bone breakdown. This is an older female, so she could be going through an osteoporosis or osteopenia cycle. This patient does have osteopenia, so that's a sign that her bones may be breaking down a little bit more. Again, how do we fix that? We'll talk about that in office. If that's your issue, we'll talk about, okay, how do we fix it? What do we do? And then the last one on this page is leptin. Leptin is your hunger hormone. So do you find yourself being hungry all the time, right? You eat and then you're just constantly hungry. That could be a hormone imbalance, and that could be related to diabetes as well. So if you're dealing with diabetes or close to diabetes like this patient is, you'll notice that her leptin is, and there's some markers down here, her leptin is very high, very high. So again, that's a sign that she's dealing with some impending diabetes, which we're working on fixing. Last page. Fatty acids, specifically omega-3s and omega-6s. There's other omegas out there, but these are some of the most important. Omega-3s, most famously found in fish, but also in vegetables too. We want to make sure that your omega-3s are all good. So all these, DHA, EPA, DPA, total omega-3, arachidonic acid, linoleic acid are all omega-3. So we want to make sure, again, those are in good range. And if you look at the reference range, I'd like to see them kind of middle-high range. And then omega-6. Omega-6 is a very important fatty acid too, but if it's too high, that can cause inflammation in itself. So we want to make sure that your omega-3 and omega-6 are in a good ratio. And a good ratio is like a 1-to-3 ratio. So for every 1 omega-3, you should have 3 or 2, so it could be a 1-to-3, a 1-to-2 ratio, 3 or 2 omega-6s. So that's the ratio you're looking for, and that's how they make that index on the bottom. And that's why, because this patient is not quite at a 1-to-3 ratio, she's in moderate range of risk for her omega-3s being too low. Friends, this was a lot of information, and thank you so much for watching this video, and thank you so much for taking the time to go through this, because this will make our visit so much more effective, because we can actually talk about your issues instead of spending this time talking about the basics. And you can watch this video over and over and over again. If you ever have any questions, please call me, please ask, and we'll take care of you, I promise.